wouldn't have to go anywhere because this is the Talk Beat Jones and
All right. Yes, indeed. Yes, indeed. Yes, indeed. This is the Talk Beat Jones, and I got my work outfit on today. Remember, the Talk Beat Jones, we're on the air every Wednesday live from 10 a.m. to 11 a.m. And on the Wednesday, of course, we are here with Dr. H. Jeffrey Watson. You know, today we're looking to see if we can contact him. It may have been one of his long days, and I was not able to reach him this morning. It was on me, not on the doc. So we continue. Remember, we can see the Talk Beat Jones every Wednesday from 10 a.m. to 11 a.m. Also, you can watch us on Sundays from 4 to 5 p.m. on 15.2. And of course, that R.J. Watkins page. And when you go to that R.J. Watkins page, you'll see the kind of like with my Jones Society shirt, the black and white. You want to go with what you see where our telephone numbers are highlighted in red and white. That's what you want to hit when you go to the black and white. Then you go back to the research search, R.J. Watkins, Robert Watkins, and you'll come up with the red and white. That's the one you'll scroll, and you'll be able to watch us live. You'll be able to call in live. You know, today I've been watching the station. I've been watching the station. I've been watching the station and watching the programs. I've been watching all of the new programs. I've been watching all of the programs that have been here for a little period of time. And I just say this to my fellow family members on television personalities here at this station. I have to give everybody a hand. I have to give everybody a hand. And to my family here across the world, for what Mr. R.J. Watkins and for what Mr. Henry Tyler and the brilliant engineer, Mr. Timmy Tim, what is going on here is this station is competing. It's competing with everybody else to give you, family, a station that you can comfortably follow, be informed, be guided, be loved, answer questions, help you in all different forms of the lifestyles right here on this particular station. And this business is for real. And I'm going to ask folks who directly support the Talk Beat Jones, support other shows, etc. But I'm going to make my appeal. Family, whoo, I'm going to just say this. When watching this station, I had no idea that this station was so wonderful in terms of all of the shows. So when I tell you, when I come here and tell you that I'm competing for your love, it's, you know, we can share it, but I'm competing when we need you to help us to go to this app. $ WHPR TV radio. Once again, family, show that love and show that appreciation and go to that app, $ WHPR TV radio. And I want to give our lead flagship program, Truth to Power, Darren Griffin. The program is just stepped, it was already high. And the levels that is working at now is just like, come on now, should we take it to the space? There is no doubt that this station is reaching with power. And as we get up now, as we're going into this part of the year, When we talk about reaching for power, we're talking about showing you things that you can learn from at home and adapt. But sometimes we need that extra kick. And sometimes you have to kick yourself to get that kick. I'm wearing a shirt today to inspire me, not anyone else. I'm wearing this shirt today to inspire me. Why? Because for folks who have followed me and listened to me from time to time, you know that there was a person that I was taking care of 24 hours a day, 7 days a week. Couldn't get out the bed, couldn't do anything, blind. I had to change the lady, turn the lady, help with this dead weight. My back was injured. My ability to do things was hampered. I'm trying to work back from that. Now, she made a transition in February. And I received no love, no respect from others. But I did that completely by myself, and I thank God for giving me the strength to give this lady the ability to do what she wanted to do, which was to make her transition from her home. Not from a hospice location, but she wanted to be at home. People did not respect that. I did. And I gave my time, 24 hours a day, 7 days a week. Injured myself. But we got through it. And now it's my turn. I've told you that if you don't use it, you're going to lose it. And I lost it. Billy E. Jones, Jones' size. That guy that got thousands and thousands of folks that are still inspired and working on their bodies and feeling good. Just know that health is your wealth. And my wealth kind of ran low. But guess what? We're going to put fuel back in the tank. We're going to take these feet that are not working properly any further. We're going to take this area of the body, going from the ankles up to the mid-calves, that have developed a problem. We're going to take the conditioning, bring it back up to par. You see, when you have the ability to understand how to teach others, you have that within yourself that never goes away. But it's like anything and anyone else. Goes back to the process. If you don't use it, you will lose it. It may look all right, but it's not all right. So we got to go to work. And you see, the wonderful thing about having Dr. Watson with me as the person that's pushing everything at this point, as we are moving forward with Dr. H. Jeffrey Watson, that will be bringing to you his health beat. Yes, his health beat. So you're going to be okay. You're going to be okay in trying to get yourself back together, come off a tough winter. Those who kind of slowed it up. And for those friends and fans who, let's see. Hello?
Hey, Dr. Watson.
Hey, now, Dr. Watson. Can we get up a little louder here? But I tell you, Dr. Watson, we're going to have you, like you say you do, get up in the morning and get that voice changed so we can hear you real good. But hey, Doc, lost my telephone.
Yeah. It's 868-4336.
Yeah. I'll have you on in just. In fact, you're live right now, Doc. You're live,
Yeah.
right? You're live right now. And so let's.
Okay, good morning, Billy Jones.
Good morning, doctor. I was just explaining to folks how badly out of condition I am. I was just simply explaining to folks how my feet bad. That area from my ankles to my calves is bad. I was talking about my done went bad. I talked about the fact that I took care of this client for over a year, 14 months, blind, 5'10", about 180 pounds, completely bedbound, couldn't do anything for themselves. I had to do everything, hurt my back, and I'm a mess. But hey, Doc, I got on my Jones Aside shirt today to help inspire me. The weather's gonna be good, so I think that as we get ready to talk about one of the things I would like for you to speak, Doc, is you take it. I'm going to shut up for a period of time. I want you to also let them know about your health beat, because Talk Beat Jones will be presenting your health beat with pictures, statements, arrangements with you. And hopefully, Doctor, will be able to get you to do some of those health fairs that you were doing in the Bay Area out here in Detroit, Michigan. So can you kind of speak on that? And I'm going to be quiet and listen to you. Happy to have you, Dr. H. Jeffrey Watson, y'all, the MD that loves you all around the world.
Well, good morning, Billy E. Jones.
Yes, sir.
It's a blessing to be here. We were together on Soul Beat for, maybe 30 years or so.
That television show, the television station, yes, sir.
Yeah, in Oakland, Berkeley, San Leandro, Alameda, in all of those areas. And you spoke of something that you could have been reading my mind, because I was going to tell you the feet don't fail me now.
Ooh.
Feet don't fail me now. You remember?
Yes, sir.
That song, who was that, Funkadelic?
Yes.
Feet don't fail me now.
Feet don't fail me now.
So you always hear me talking about I'm a general internal medicine doctor.
Yes.
And on the Health Beat show, we frequently took questions about everything from your nose to your toes. From your nose to your toes. So today, I'm going to talk to you a little bit about feet.
Yes.
There is a special kind of doctor called a podiatrist.
Yes, sir.
That takes care of your feet. Not a psychiatrist, but the psychiatrist takes care of what's behind your nose.
Oh, my nose.
But the podiatrist takes care of your feet.
Yes.
Now, one thing probably most of us have experienced is a thing called athlete's foot.
Mm-hmm.
Athlete's foot. And you, with your exercise equipment, make sure you wear some thongs if you go to the gym, because athlete's foot, otherwise called tinea pedis, P-E-D-I-S, which is a foot fungus. Often it gets between your toes and on the bottom of your feet, causing flaking. And there's different things that you can do. Certainly you want to keep your feet clean.
Mm-hmm.
There's sprays that you can spray on it. There's fungal creams that you can put between your toes.
Mm-hmm.
And sometimes
Yes.
you might want to put a little cotton ball
Mm-hmm.
between the toes so that your toes can breathe, because tinea pedis, or athlete's foot,
Mm-hmm.
often happens in athletes, but also in warm, wet environments, in shoes that haven't been cleaned, or in socks that had the infection in it and were never cleaned well,
Mm-hmm.
but also in gyms and places like that. So it is treatable, and that's just the foot. Now, let's go to the nail. Let's go to the toenail.
Okay.
They call that, you can call it toenail infection, or the medical name is onychomycosis. Onychomycosis.
Okay.
And that's an infection of the nail with fungus.
Mm-hmm. Mm-hmm.
Now, that's kind of difficult to get rid of.
Okay.
The toenails might be long, and the fungus gets under the nail,
Ooh, okay.
and it gets into the bed of your toes under the nail. And so typically we try to cut the nails back. You can use, again, the creams, but the creams don't always penetrate the nail.
Mm-hmm.
And this, again, the toenail infection, onychomycosis, they do have pills that you can take, itraconazole, but those do risk some possibility of liver damage. And you have to take them about 3 months for them to work. So if you do get a chance to go to the podiatrist,
Mm-hmm.
not the psychiatrist, but the podiatrist, 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 they may use a laser and make a little hole in the nails
Mm-hmm.
and drop medication, antifungal medication, down through the hole, because that's one of the ways that you penetrate to get down into the nail
Okay.
and underneath the nail. So those are athlete's foot and toenail infections, something that's just real common for everybody. But, you don't always hear us talking about it. Now, what is another
Now,
major...
can you also talk about, take a short time and talk about all these wonderful, great creams that guarantee that within 1 week or 2 weeks or 3 weeks, your fungus will be gone, and we're spending all this money being assured by all these great companies with these creams that we're going to be okay.
Well, the creams, nystatin, Lotrimin, and creams like that, those are best for athlete's foot or infection in between the toes. They don't work as well for the nail.
Mm-hmm.
But, there are some creams but you have to use them for a long time.
Okay.
You gotta, cut your nails. And here's another thing that I was leading up to,
Okay.
which makes it really hard for the toenail and athlete's foot to heal, is if you have poor circulation and or if you have diabetes.
Mm-hmm. Okay.
If you have diabetes. Now, the major amputations in the United States are often in diabetic patients. And what happens with the diabetic patient is they get numbness in the feet, get numbness. Neuropathy is what we call it.
Yes.
Neuropathy. Step on a pebble, stub your toe, and next thing you know, a blister comes up, and the next thing you know, the blister pops. And because of the poor circulation, you can't get good blood down there. And if it's infected with bacteria, you might have to take an antibiotic. And if the circulation and infection doesn't get any better, that's when people start losing their toes.
Wow.
And it goes up the toes go first, then maybe the foot goes next if it gets infected. So the creams are good for between the toes for athlete's foot. You can try them on the nails, and it may take an extensive amount of time, but it's at least worth trying. And then you have to do all the stuff at home, clean the shower floor. You have to make sure that if you are a diabetic, that you keep your sugar under control, and that you may need to have a test either ordered by your primary care doctor or by the podiatrist, which checks your blood flow. And it's a pretty simple test to start with. They just rub a microphone on your legs to see if the blood is pounding. And so there's two, I was thinking about this, there's two kinds of blood vessels.
Okay.
There's the arteries. Now, the artery takes blood from your heart. It goes down your abdomen, which is the aorta. Then it splits in two. One going to your right leg, one going to your left leg, femoral artery. And then as it goes down, it usually runs behind the knee, popliteal artery. and then down to the feet. So arteries take blood down.
Mm-hmm.
But now you see people walking around with swollen ankles too.
Yes.
Swollen ankles, and that's because the blood is not getting pushed back. It's coming up a vein, and as it gets down to the bottom of your foot,
Right.
it transitions over into veins, and there's not a heart down there to push it back.
Okay.
So the thing that you always have done with Jonesercise and you're going to do today is you could get on a bicycle and pedal, and that'll push the blood back up to your heart and help take the swelling down. You can elevate your legs when you lay down, and that assists the blood from to come back up the veins back to your heart.
Yes.
And you've seen these commercials where you can get these cyclic devices where you sit down and it could be under your desk at work and you're just pumping your legs.
Yes.
Right?
Yes.
And that's pumping it back.
Yes.
There you go. Or walking, the good old walk,
Yes.
or jog.
Yes.
So feet don't fail me now.
and Doc,
That's what we're talking about.
and see, Doc, please don't lose your thought because what I'm going to just quickly say. When we talk about if you don't use it, you're going to lose it. Well, you gave us a simplicity of either walking or just doing a little small, easy jogging. My situation was through the years, I always was able to break out and do my walking or do my little jogging. It was how I kept myself somewhat, along with other things. But over this past years, I was mentioning to folks that I took care of a client for 14 months who just made a transition in February. But during that time, those injuries were, because I was not walking, was not jogging, was not taking care of doing the things that I normally would do to maintain. And so, like I said, so I'm totally gone. But we're on the recovery. That's what I'm saying. We got you, and we'll talk about recovery. Please continue where you are. I just want to say that you're on track with where I am because my feet is very important to me.
Mm-hmm.
Very important to me.
Yeah, well, that's why we're talking about that today. Feet don't fail me now.
Yes.
And certainly there are things that you can do. Like in Oakland here today, it's raining, it's kind of stormy, and usually you could get out. But if you can't get out, maybe you can go to the gym, or you can lie down on your back and pump your legs up in the air, like a bicycle move.
Yes.
Or you could go to a set of stairs and go up and down on your tippy toes, up and down on your tippy toes.
Hey, Doc, can we revisit this after the break? Because I want you to be able to continue to flow without me having to interrupt you at any particular point. Because, family, we're talking about health care. We're talking about that you don't understand why you went from almost not feeling good to all of a sudden feeling bad to all of a sudden you're in terrible health condition. We're talking about starting from the feet. And the doctor's taking care of you. Listen and learn how to be greater, better for yourself. Doc, we'll be right back after these commercials on the Talk Beat Jones. And the program is with H. Jeffrey Watson, M.D. I am Billy E. Jones. This is Talk Beat Jones. But again, family, Dr. Watson is preparing to bring to you also the Health Beat format on the Talk Beat Jones. Be back shortly.
Have to go anywhere because this is the Talk Beat Jones, and
Justice for Mario Willis. Truth. Facts. Evidence. Matter. Log into justiceformariowillis.com. Read for yourself.
You're watching Detroit's own WHPR TV. Detroit Live.
Hi, this is Billy E. Jones, Talk Beat Jones. You can watch me 24 hours a day, 7 days a week on WHPR TV 33 Now app. Download our free app at WHPR TV Now.
If you enjoy the music, the talk, and the vibe right here on WHPR, we need your support. Help us keep independent radio alive by sending a Cash App donation of whatever you can to $WHPR TV Radio. Every dollar makes a difference. That's $WHPR TV Radio. Support the station that supports you.
I'm Wayne County Treasurer Eric Sabri. If you're behind on your property taxes, we have programs to help. You don't have to lose your house, and you don't have to pay all at once. This summer, our mobile unit will be visiting Wayne County communities to help make it easier to start a payment plan and keep your property. Go online or call to find the plan that's right for you and where you can get help from our mobile unit. The last thing I want is for anyone to lose their property to foreclosure. Make your payments every month and keep your property.
Hey, what's up? This is Timmy Tim. I got all of Detroit on lock to bring you the best in late night entertainment. From music videos to artist interviews to concerts and special events. So you rappers, comedians, club promoters, small business owners want to be on Timmy Tim Live? Give us a call at 313-828-0848 or email me at timmytimlive@gmail.com.
313watkins.com. Streaming on Roku.
You wouldn't have to go anywhere because this is the Talk Beat Jones, and
Oh, family, this is Happy Day, Happy Day, Happy Day. We've got H. Jeffrey Watson, MD, with us. This is the Talk Beat Jones, and soon it will be featuring Dr. Watson and his Health Beat format as well. But again, you can watch the Talk Beat Jones every Wednesday live right here on WHPR, WHBS, and again, it's from 10 a.m. to 11 a.m. And on Sundays, we're on the air from 4 to 5 p.m. on 15.2. And family, please tell your friends about the program and also about the donation, or go to the Cash App, $WHPR TV Radio. Once again, that's $WHPR TV Radio. I'm going to talk about it because, again, if I can encourage you to do a little Cash App, thank you. Doc.
Yes, sir, Mr. Billy E. Jones.
Yes, sir.
How's it going?
Yes, we were talking as we was headed to the break about your feet. And last thing I want to ask you about folks who are having these hot tub parties and events, and people are jumping out and going from wherever they undress to the hot tub or whatever it is, and they don't have nothing on their feet. What do you think about that?
I think it's very important to have some kind of a product like a thong or a sandal or something like that. You can get them, rubber, but if, we're talking about feet don't fail me now, and it's just so important that you keep your feet clean because this is such a easily transmitted disorder. Is to get athlete's foot and to get infection of your toenails. And particularly the toenail one is really hard to get. And so when we were off air, we were talking a little bit about also from your ankle all the way up to your knee.
Yes.
And the main muscle in the calf area is the gastrocnemius muscle.
Okay.
Gastrocnemius muscle. And it looks like a pear upside down, such that the stem, if it were a pear that was upside down, the stem is connected to the Achilles tendon.
Yes.
The Achilles tendon. And you see all these basketball players, and I hurt my Achilles tendon. I know you have injured your legs before.
Yes.
And in that area of the calf, there are compartments. There are compartments. So if you think of eating a chicken leg, you'll see a little shining area that's right up before you get to the fatty or the meaty part of the chicken leg.
The muscle part, yeah.
And, yeah, and that's part of the compartment in the leg.
Mm-hmm.
Now, things can happen in the compartment. You can get a thing called compartment syndrome, where the swelling after an injury starts to pinch off some of the blood vessels, both the artery and or the vein, because the vein is coming back. It's trying to send blood back. And if it can't get back well, your leg can swell. Then there are other things, and I was just talking about getting a test on your leg where you can just run a microphone, and they call it a Doppler test. A Doppler test. Venous would check your veins, and arterial Doppler would check your artery in the leg. And if there is a finding of a blood clot, the first thing the doctors will usually do is put you on a blood thinner. And that could be a shot, or it could be pills, or it could be something as simple as taking an aspirin-like medicine a day to thin your blood so we can get by some of the areas where there are clots. The most common shot is Lovenox. That's a heparin-like shot. And the more common blood thinner pills, Coumadin, that's a very common one. But we have some new pills that are out there that you can take once a day that will thin the blood in your leg. Now, one thing we were talking about also is how you got to really look out for your feet. If you don't feel me now, because African Americans, we make up 12% of the population, but about 30% of the diabetes.
Wow.
So, yeah, about 30%. And most people don't even know it. What are some of the signs and symptoms? You're peeing a lot. You get numbness in the feet. You may have blurred vision. You may lose a lot of weight. So one test that you can have your doctor do when you go for your checkup, or even if you're just worried, is, of course, they can stick your finger and check your blood sugar.
Mm-hmm.
But if you hadn't eaten anything, it might not be high. But there's a test called the hemoglobin A1C. Hemoglobin A1C. The normal level is 6, and that equals to a blood sugar of 126. If it's 7, for every 1 point that goes up, and this tests your sugar over a 3-month period. It averages over a 3-month period. If it goes up 1 point to 7, you add 30 points to the 126, which would mean on the average it would be 156. If the hemoglobin A1C was 8, you would add 6 plus 1 plus 1 equals 8, and that would mean your average blood sugar would be 126 plus 30, which would be 156, and you add one more 30 points, it would be 186. And above 186 is diabetes. If it's after you've eaten, above 126 with no food is considered diabetes. So usually you want to take these kind of tests fasting, or where you haven't just eaten a big meal, so we can get a better look at it. So that's a little bit about the calf and the Achilles tendon. Now, here's another thing that we see with a lot of the athletes is ankle injuries.
Mm-hmm.
Ankle injuries. So, you know, below the knee, there's two bones that go down to the ankle.
Yes.
The tibia and the fibula. Two bones, and when it gets down
I broke
to the
and I broke both of my ankles. I broke one ankle playing football, and you know, and the other ankle while I had my Jones exercise. We took the little kids back to the skating rink, and you know, I would send my Jones exercise members to continue having fun while I would take the children back to skate. And one little kid grabbed me and pulled me down and fell awkwardly and broke my ankle. So please continue. So you can have those injuries from way in the past, and they start to take effect on you.
Yeah, and you know the inside of your ankle, there's a bump where the bone comes down and connects to your ankle, and outside there's a bump, and that's called, the inside one is called the medial malleolus, and the outside is called the lateral malleolus.
Mm-hmm.
And there's all kind of tendons that connect the tibia and fibula to the foot, and so you can tear a tendon in the ankle.
Mm-hmm.
You can break a bone in the ankle.
Yes.
And it can be complex. Did you have to have surgery on your ankle?
No, sir. In fact, two different things. When I was playing the football and I broke the ankle, broke my ankle playing football. They told me that I probably would never play again because it was a senior and we only had so many games left. But I fooled them. I got out. I worked extremely, extremely, extremely hard, and I was able to come back and play. And of course, I intercepted the game-winning pass from Harold Carmichael.
Okay.
But the thing there is, when I broke the ankle, we was filming Jones exercise as well on a weekly basis, and they put the cast on, and you know I couldn't, as we were getting ready to do some filming, I couldn't go and I could not perform, so I cut the cast off myself.
Oh my God.
You know, so I probably didn't allow my ankles to heal completely proper, but that was one of the reasons why I worked so hard with my Jones exercise and Jones exercise members, so that I could keep my joints strong, my tendons working proper, that my pain threshold would be high. You know, because if you don't use it, you're going to hurt pretty badly. And also trying to come back, a fear that I have had is not the workouts. It's if you're out of shape, it's the workouts, that little pain you're going to go through to get in shape.
And they say no pain, no gain, right? That's what people say. But you know, one thing people are starting to realize is, particularly those over the age of 50,
Mm-hmm.
which I know you're 49.
Yes.
So you can do the chair exercises.
Yes.
Chair exercise. So you sit down in the chair and you lift your left knee and touch it with your right elbow. Then you lift your right knee and touch it with your left elbow, or you elevate your legs out straight. You can almost do sit-ups in the chair, you know. So be careful, and as you know, don't try to get fit all in one day. Take your time to pace yourself.
Yes.
Yeah, because we don't want you to get injured again.
That's right. Don't want the chair to go backwards either.
Yeah, there you go. There you go. You got it. You got it. Yeah. Okay.
That would
now
be.
You look like you're in the nightclub now. Yeah, but those are good exercises.
Yes.
Know? And they can get you strong. And then there's Tai Chi.
Mm-hmm.
we don't have to do a lot of jumping and all that kind of stuff. So you can still get in shape.
Yes.
You can still get in shape.
Yes. Yes.
So that's it. Now, people, I asked if you had to have surgery because one of the things that patients have told me a lot,
Mm-hmm.
and at first I didn't get it at first, but they said when it gets cold, their ankle, the one that they broke, really gets painful.
Yes.
And I said, okay, let me look at your ankle. And then I could see where the scar was.
Mm-hmm.
And then
Yes.
I rubbed it, and I said, did they put pins in your ankle?
Yes.
And they said, yeah. And I said, well, did they ever talk about taking them out? And they said, no, they just said, this is what's going to allow your ankle to heal. So when the weather gets cold, the pins get cold. And then the ankle hurts. Now...
Uh-oh. Doc, you still there? Okay. Dr. Watson, call right back. Caller, how are you doing? Hello? Okay, I did that. Dr. Watson's watching the program. Doc, call back, and we'll try to get you in. I had another call that was trying to get through, and I was so excited about listening to Dr. Watson speak on this subject that I pressed the other caller, which eliminated Dr. Watson. Okay.
I'll be back.
You're back. Glad to have you back, Doc. I'm sorry, but you had a caller that what I will do, caller, is that you can do that, and I was trying to put you in a conference call mode. Found that we have a conference call mode on this phone whereby you can actually be talking directly with Dr. Watson. And Dr. Watson, as you get ready to come back, I will say that we sometimes may have me to come in dressed to actually do some things that you're talking about on the air. Nothing too hard, Doc. So that we'll actually be able to develop a little time segment where people want to get up and do a little 5-6 minutes thing with us. I'll be the demonstrator. You can be the person that's telling us how to do what we're doing. And we kind of work it together. Some wonderful things.
That sounds great. When you talk about the Health Beat model
Yes.
that we did on Soul Beat,
Yes, sir.
and which I've done on several other stations, is we would start out the show with the interview, then we would go to fitness facts, and I might have a pre-recording with a screener or someone with your experience, which you just did an excellent demonstration.
Doc, hold on 1 second. Doc, hold on 1 second and don't go in place. I'm going to try to get this right.
Okay.
Caller, are you there?
Yes. Can you hear me?
Yes, I can, clearly. Thank you for calling. You're speaking with Billy E. Jones and H. Jeffrey Watson, M.D.
Good morning, gentlemen. I'm sitting here watching you on 15.2.
Thank you. Appreciate it.
All right. My call today is, you guys are talking about the right subject today, but I'm probably at the end of the road now. I got two black left toes that just black to the core. Black is your background, Billy.
Wow. Okay.
Now, my question to Dr. Watson: is that pretty much the end of the road stage when you got two black nail beds on your toes?
Hold on, I'm gonna get Dr. Watson to answer your question for you.
Okay.
Doctor, you're back with him?
Yeah, I heard the question. So do you have the rest of your toes, or it's just the nails are black?
Hold on. Caller, are you there?
Yes, just the nails are black.
Doctor, you're back.
That is probably the kind of situation where you want to go to a foot specialist, a podiatrist, and they may remove the nail, and a new one will grow out. It's a little bit painful, but they can numb it up, remove it, a new one will come out. And the other possibilities are to do the laser on it and put little holes in the nails, and then drop, if it's not too thick, because sometimes the nails get really thick, but they can drop medicine down into it. By the time they get black and they're not too thick, you can keep putting antifungal creams on, or the doctor can also give you a pill called itraconazole. Itraconazole is an antifungal pill, and keep cutting the nail back until after a while, if the nail is still growing, it'll grow out, so to speak. It'll grow out. But if the nails are all the way black, it's probably time to see a foot specialist, a podiatrist.
Continue, Doc, please. Doc?
Yes.
You were saying see a podiatrist.
Yes, a podiatrist. That's going to be the best thing. And I would say go ahead and do that, because our healthcare system is going to be changing, and some people are going to lose their insurance, and then here we go down a domino effect that some people are going to get sicker. In California, 1.8 people in the next year or so are going to lose their Medicaid, which is, in California, we call it Medi-Cal. And that's for people who are either disabled or have a low income. So, podiatrist, you could call your county healthcare system. They can give you the name of some that would probably take his insurance. In the meantime, keep the foot clean, cut the nails back. You could start using antifungal cream, and then have a discussion about whether the podiatrist has the technology to laser the nail or to remove the nail and let a new one grow out.
Hold on, caller. I'm going to ask if we can get Dr. Watson back on the screen. I want this patient to see the doctor that he is talking with at this point. And doctor, when you have a person calling you like this, is it possible that this person, now that he's made contact with you, maybe in another week or 2 or 3, be able to call you back for a little follow-up on if he's able to get some progress or find some help?
Yes, absolutely. Absolutely. I'd always like to see, what the outcome is.
Mm-hmm. Hold on.
But those things that I mentioned, those are kind of the standard of care for your feet.
Okay, hold on, Doc. Hi, sir. How are you doing again?
Yes, sir. That was great advice. I appreciate it, Dr. Watson. My toes were at the end of their road, made it so black, man. But now I got that advice from you. It'll help me out to move on forward.
Well, this is what we're saying. You have a medical doctor that can treat everything concerning your body and your care. And we're inviting you, again, that we will do a follow-up. This is something that you can do anytime you choose to do when we're on the air. This doctor's let you know how he feels about persons that come to him, talk with him about their health. Excuse me, I don't have to talk to Doc for the doc. Let the doc at the doc. Hold on. Doc, you give them your understanding about who you are and what you're about, please.
Yes, I have been a board-certified internal medicine doctor for, over 30 years, and have practiced in Oakland for almost 40 years, and have practiced in the hospital as a hospitalist in intensive care. I had an office for 40 years as well. And, I always say if you knew better, you could do better. Now, from the nice gentleman, one thing I wanted to make sure that he is clear with me about is that just the nails are black or the toes black also? Because if the toes are black, that means the circulation is poor and you're getting gangrene in the toes. But if the toes are not black, it's less of a chance that it's a blood vessel problem.
Okay.
So we would want to know, and if the toes were black, he'd want to have what we call the ultrasound, arterial ultrasound, to check the circulation in his feet.
Okay.
But again, if it's just the nails, we can go through the things, cut the nails back, do the laser therapy, the creams, remove the nails, those types of things. And certainly, if there's any diabetes there, you've got to really make sure that the diabetes is under control.
Well, Doc, let's find out if he had a diabetic problem as well. Hold on. My friend, are you also a diabetic person?
No, sir. No, sir.
Okay. Hold on. Yes, doctor. No diabetes there.
That's good news. That's good news. Are the toes black? Not just the nails. Are the toes black?
You're on the air, sir.
Yes, sir. Just the toes.
You're back, Doc.
Nails or the toes as well?
You're back, sir.
No, just the nail beds.
You're on.
That's good to know. That's good to know. But so I would proceed with the things that I first indicated. Cutting the nails back, keeping your feet clean, antifungal creams, Lotrimin, nystatin, you get some of those over the counter. And just try to, and then follow up with the podiatrist, foot doctor.
And Doc, one of the great things about the show at this point today, my friend, you will be able to go to YouTube, TV 33 on demand. This show will be in that queue in about a day or two. You can pull up this show for your convenience to watch at any given time. Therefore, the information that Dr. Watson is giving to you personal, you will be able to play that at your own time schedule, watch it, listen to extensively, carefully, as the doctor will be able to continuously play. You'll be able to continuously play that and able to follow to understand exactly what Dr. Watson is advising you of today. Okay? Let me hit him real quick.
Much, Dr. Watson.
Yes, sir. That's H. Jeffrey Watson. Okay?
Okay, and what I'll do is I'll call back in a few weeks and give you an update.
All right, and then do one us a favor. Would you tell your friends that may have some situations that they need some advice, they need some help, that we've got the doctor that loves you, takes care of you, and by the way, he was the president of the Doctors Associations, etc. So we've got the man who is primo. How about that?
That's good enough. No.
All right, brother.
Gentlemen, have a great day.
All right. Thank you so very much. You're back, Doc.
Okay. One thing, since you are an athlete and you may be doing some stuff that could pound on your feet, one thing that I woke up one morning and I put my foot down on the floor and I thought I had stepped on glass. I thought I'd stepped on glass. The bottom of my foot hurt so much. We talked about the back part of your leg has the gastrocnemius muscle. Then connected to that muscle is a string or a tendon called the Achilles tendon. The Achilles tendon attaches to your heel bone in the foot.
Doc, stop. Doc, hold on. Extensively tell why that is so important, because when those athletes get that Achilles injured, they're gone. They're not coming back.
Yeah, they may have to have surgery, but one common thing to the average person too, including myself, and is you get a heel spur. And if you ever had an x-ray of your foot and you had a heel spur, it would look like you had a needle sticking out of your bone, out of your heel bone. And that needle is a bone chip, and the bone chip irritates what we call the fascia of the bottom of your foot when you walk, when you put your foot down.
Right, right.
And so you get what they call plantar fasciitis.
Yes.
Plantar fascia. And when I had it, I mean, you know, you can take ibuprofen. Sometimes the podiatrist will give you a shot in it. And if you're a big athlete, sometimes they'll go in and surgically remove it.
We forgot, Doc, that you are an athlete yourself.
Yes, sir.
Yeah.
I played college football for 2 years, ran track. You know, I've done a few things.
Yeah, I mean, you know, let's let the people know that we got a complete man here, y'all. Complete man. Go ahead, sir.
And I've been the doctor for several professional boxers, athletes.
Ooh-wee.
And I always have taken care of the youth football. And so a lot of times when you're talking about you got pulled over, fell down on the ice and broke your ankle.
Yes.
We give a lot of those athletes, you notice that the boxers wear high top shoes.
Yes.
And before we let the young ones go out, we tape their ankles.
Yes.
Tape them from the bottom of their foot all the way up, probably halfway up the gastrocnemius.
You know, Doc, this right here is getting good, but our time has come, that time where he's about to pull me off, that thing and pull me by the neck off the air. So, but I want to say this has been the prototype of where we're going. We're going to have folks calling and talking, and family, you see how it can operate and be wonderful for you. Please, Cash App, make a $sign. Go to that $sign, WHPR TV radio, because we're going to be doing this big for you. Doc, so you see, we have folks that will call you, but now we've got to say goodbye.
Well, it's always a pleasure. It's always a pleasure. You're always going to hear me say that your health is your wealth, and when you have your health, you have everything. And as we educate people, you realize that if you knew better, you could do better. God bless.
Bless you, Doctor. We just love you so very, very much. And again, the world is going to understand what Dr. Watson, the movement that you're doing right here from your area, that when you start asking folks to come to your health fairs that you want to organize out here in the Detroit area, it's going to be a wonderful thing. Appreciate you, Dr. Watson.
Okay,
Love
we
you,
have
man.
a health fair in San Leandro on Friday and Saturday, and it's about the feet.
Yes.
So
Oh,
feet, don't fail me now.
yes. So is that something that we got to go, but is that something that we're going to potentially be able to organize out of here in the Detroit area as well?
Yes.
Okay. Sounds great. Sounds great.
Yeah.
Thank you, Dr. Watson. We love you so very much and appreciate you, because we have some wonderful things in store for our community around the world. Appreciate you, Doc.
Appreciate you, Billy.
Okay, Doc, bye now.
You take care.
Yeah.
All right. God bless.
Okay. Family, this has been the Talk Beat Jones. You see what we're talking about, family? When I say we do it like nobody else. But everybody else is doing some wonderful, great things here on this station. So we all good. Tune in every Wednesday from 10 a.m. to 11. Also on Sundays from 4 to 5 on 15.15.2. And we love you, appreciate you, and I'm going to do it one more time. Cash App, $sign, WHPR TV radio. And love you, appreciate you, stay strong. And remember, if you don't use it, you will lose it. Billy Jones saying we love you. Bye-bye.
You don't have to go anywhere, because this is the Talk Beat Jones. And I